All right, so I'm Dr. Gajer, and we will start the presentation. Some people are still making their way in, so um, we'll go ahead and get started. Thank you so much for everyone who's here. Welcome. And today we're going to talk about weight loss and the science of weight loss. And I want to give you as much of my experience as I can, what I've seen work as a weight loss doctor and what I have seen that has not worked, and hopefully dispel some confusion that's out there right now. So, I want to start by giving you just a little bit of background on who I am and who you're listening to. So, I am a conventionally trained physician. I went to medical school at University of Maryland and did an emergency medicine residency at GW. I chose emergency medicine because I felt like that's where I was going to be able to make a big impact. I thought I could see people in their most dire conditions and hopefully fix things, And this first picture here is in my fourth year of residency, and what I found over the course of my training is that although I did see a lot of those dire patients, I saw patients coming in from car wrecks, from gunshot wounds, from stabbings, patients who met unfortunate accidents. And I built the skills to put a lot of those people back together. But most of what we saw in the emergency department were people who were suffering from chronic illnesses. So, people who had uncontrolled high blood pressure, people whose diabetes had gone so far out of control they were developing infections, people with congestive heart failure, people with kidney failure. And although I built those skills to sort of patch those people up, I found that they were coming in over and over again, and they were invariably worse rather than better. And I started my own studies of what can be done to actually address the root cause of some of this in some of these folks. And that's what led me to opening the Gaia practice. And I found in my research that if I had gotten to some of these people 10, 15 years before, and we had talked about how to address their metabolic health, how to eat, how to move so that these diseases could not take hold, then they would have probably been spared seeing me or someone like me over and over again in the emergency department um, until it was too late. And even the people with chronic illnesses who we could keep alive, the quality of life was so poor that it often felt like I just wasn't doing much. So when I dove into the research, I found that a lot of these things I did not learn in medical school, that there's actually a lot we can do proactively to make sure you never see me or someone like me in the emergency department with a condition that just is going to continue to get worse, um, regardless of what happens. So that kind of led me to metabolic health, to weight, because that is really the root of a lot of conditions that affect people's health in the long term. So I'm going to give you a little bit of background on how we got here and why, if you are somebody who's suffering from carrying extra weight, it is probably not your fault. So you may have seen this map in the past, but um, in 1987, about 0 to 10% of Americans were overweight in most states. Most people, if you look at pictures from 1987 before, most people were relatively lean. And then we get to 2021, and all of a sudden, 35% plus of Americans are overweight or obese. And I don't think that human beings changed fundamentally in that time period. Something changed in our environment that made it very hard for people to stay lean and maintain a normal body weight. And we'll talk a little bit about that. So, many of you probably remember this lovely food pyramid that the FDA recommended between 1992 and 2005. So as we noticed that society was gaining weight, um, this was the recommendation. Eat 6 to 11 servings of bread, cereal, rice, and pasta, and then make sure to have some vegetables and eat your meat sparingly. And some of this was rooted in the fact um, that fat has a lot more calories than protein or carbs. And most protein sources, at least animal sources, do contain some fat. So because carbs only have 4 calories per gram, they were thought to be the best food to eat to maintain a normal weight and to keep calories low. And protein, because it often had fat, was deemed to not favorable um, in terms of maintaining a good body mass. So we all know how this experiment has gone, where those recommendations caused most of us to become more unhealthy and has made weight management much harder. And now we understand weight in a much different way. So um, the thought was that if we pull fat out of most foods, people would maintain a normal weight. But a lot of those naturally fatty foods were replaced with non-food products, artificial foods, really processed foods, which really made the problem worse. So for a long time, it was thought that it's really just the calories. If you're somebody who struggled with weight and you went to a doctor, most of the time you would be told, eat less, move more. And we were surprised to find why that didn't work, but clearly that is misguided suggestions. And if it were that simple, then we wouldn't be in this situation. So there's a lot more to weight. Their calories certainly matter, but hormone balance, inflammation, gut health, sleep, and stress are also really important to maintaining a healthy weight. So we will go through these briefly. Um, so the question is a calorie a calorie? Again, is it the same no matter what source of calories you get, or does what you eat matter? And I'm going to suggest that what you eat really does matter. And calories are important. And if you eat too many calories, you will likely gain weight. But the food that you eat gives signals to your body on how to process that food. Your body is constantly deciding whether you are going to store the food that you eat as fat on your body or whether you're going to use it as energy and use it as fuel. And that is where your hormones come in. So, um, this kind of breaks down the hormones that live in your body and um, when we think of hormones, we often think about sex hormones, so estrogen, progesterone, testosterone, but there is far more hormones that are really important for health and weight in particular. So, um, well before thinking about sex hormones, the most important foundational hormones in your body are those that govern your metabolic health. So, insulin is the key hormone that governs metabolic health. Insulin is a hormone that opens the door to cells to receive blood sugar and turn that into energy. And because of our food environment, because we are now exposed to so many convenient foods that have non-food chemicals in them, many people have become insulin resistant. And when we're insulin resistant, when there's too much insulin in the bloodstream, and your cells are not sensitive to listening to its signal, it signals to your body to store what you're eating as fat, to store everything for another day rather than use it as energy. So when we talk about insulin and metabolic health, there are behavioral strategies, which I'll talk about a little bit later on how we can make ourselves more insulin sensitive. The most important thing, if you only take one thing away, is to try to eat whole foods as much as possible. So we food scientists have made incredible gains to create foods where you really can't have just one. And they've made commercials about this, and that's not really a good thing. We've tricked our bodies into thinking that we need more and more, and some of that is very damaging to our metabolic health and makes it difficult to maintain a healthy weight. So that's really, I think, the foundation of healthy hormones is having good metabolic health, good insulin sensitivity. And then cortisol and adrenal health. So this is your stress response. We live in a world where we are now constantly plugged into devices, and the ability to reach us at any time, or the number of um, inputs we get is so much higher than we ever did as humans. And that can put our nervous system on high alert and really dysregulate our hormones and affect our ability to lose weight and maintain a healthy weight. Many people suffer from thyroid issues, and it is the most common autoimmune condition right now. And again, these non-food chemicals that are in a lot of our food have now caused a lot of our bodies to mistaken our thyroid as something foreign. Thyroid tissue in particular is similar to some of these non-food chemicals, and when your body starts attacking your own gland, you don't make the right amount of thyroid, and that can certainly affect your weight. And then sex hormones, we, again, because of our environment and the chemical exposures, there are far more people who have imbalances in sex hormones, young women. There are studies that show that men's testosterone now is about 200 points lower than men who were the same age about 20 years ago. So something is happening that's really dysregulating our bodies, and it goes far beyond calories. So, the next issue is inflammation. And some of that, all this sort of plays in together, and some of the inflammation is due to our chemical exposures. But it's sort of a circular process where fat tissue sends out inflammatory signals where if it's we are born with all the fat cells we're ever going to have. And as we gain weight, those fat cells get bigger. And as they grow, then we start putting out some chemicals that increase the inflammation in your body. And inflammation causes more of that insulin resistance, really dysregulates our appetite. When we're inflamed, you often have pretty severe cravings, low motivation for exercise, and feel like you're hungry all the time. So I could spend a whole hour just talking about inflammation, but this is something that we often, it's very hard to figure out where the inflammation is coming from, how to control it, and it's subtle how it affects what the body does in terms of holding on to fat. And we're currently learning a lot more about gut health. So we actually have more microbes in our gut than we have cells in our entire body. So we have this whole community of microbes living in our gut that are signaling to the rest of our body and our brain about numerous things, but particularly what to do with food that comes into our body. So the gut microbiome can actually control inflammation and other hormones. And we are seeing more studies that show that our gut microbiome regulates our appetite and feelings of fullness. So, for many of us, the gut microbiome is disturbed, again, due to antibiotics, due to the barrage of chemicals that we're exposed to on a regular basis. And this can really compromise how we use food for energy, and cause us to store more food as fat where we would have otherwise used that for energy. And often an overlooked factor is also sleep. So we, again, there are studies that show now that we are getting far less sleep than our relatives did 20 years ago. And sleep is far more disrupted because we have screens, there's blue light. And when we're not getting enough sleep, all our metabolic hormones can be disturbed. So poor sleep can really increase hunger hormones and decrease your satiety hormones. So if you aren't getting good sleep, you won't feel full. That point where you feel like you've had enough food will change, and it becomes very hard um, to eat the right amount of food. And also, when you're not getting enough sleep, your body just holds on to fat. It feels like it needs those reserves to keep going rather than burning that for fuel and energy. So sleep can be a crucial factor. And we've worked with a number of patients where we've gotten everything right, and all of a sudden we hit a plateau and we can't get past it. And then when we really work on sleep, all of a sudden the weight starts coming off. And poor sleep is something that when we think about weight loss, we often think, okay, I'm going to do diet, I'm going to exercise, I'm going to choose what I eat carefully, I'm going to make sure to get my workouts. But sleep is something that can really be worked on too. Developing good sleep hygiene, trying different things, and really committing to creating the right circumstances to get sleep that actually fuels the body and regenerates the cells and allows your body to use the food that you're eating as energy rather than storing it as fat. And then, of course, stress. There's uh, Everyone is exposed to some level of stress, and not all stress is bad. Sometimes, when there's a big change in life, even if it's a positive change, a new baby, a new relationship, it can trigger stress. And again, this constant connectivity in our lives, this is something that humans have never experienced before. The notifications, the ability to read news from all over the world, it has made a chemical impact on our bodies and our biochemistry. And when we do experience stress, we release stress hormones. And in the past, many, many thousands of years ago, life was boring most of the time. And once in a while, there would be an emergency, there would be a tiger chasing you, and you'd need this surge of stress chemicals to survive that time period, but then it would go down and life would become pretty boring again. Now, more and more of us are experiencing chronic stress, and it is usually not something major, but our body still interprets it as something major, and that can elevate our cortisol and really send signals to our body that we need to store the fat that we have. And again, this will trigger cravings for high calorie comfort foods, and it can disrupt your thyroid function and lower metabolism. So I think just as we need to work on sleep, I think stress is something that we need to intentionally work on too. And we often cannot remove stress. Life is what it is. We have children, we have jobs, we have all these things, but intentionally finding some routine where we can counteract the stress signals in our lives. And I think that's different for each person. Social connection, exercise, breath work, a warm bath, reading, coloring, something where you can feel the calm hormones going in. That can really counteract some of the effect that stress will have on your body. So and the last thing is mindset. It can feel pretty demoralizing to go through cycles of yo-yo dieting or periods of time where you lose weight and then you gain it back and then you lose and you gain. And often people can feel quite alone in this, and it can feel sort of fatalistic where, well, this is just my body. Anything I do doesn't allow me to lose weight long term. And I think it's really important to make sure that we are working with a growth mindset, that this is a problem that can be fixed. I think that's really important to understand and to believe. And many people who I work with have gone through many cycles of losing weight and gaining it back and just feel like maybe there's no solution for me. But it's often the case that you just haven't found the right strategy for your body, and everything that's holding you back hasn't been addressed. And just knowing that this can change. And I think it's really important for going in the right direction. So I want to talk about why being overweight, carrying extra weight is not the same for everybody. And some really interesting research that came out of the Mayo Clinic that describes what's called obesity phenotypes. So basically, why certain people are storing extra fat and having trouble burning it. So Dr. Acosta out of the Mayo Clinic found that there's four distinct types of people, and not everyone fits very neatly into one category. And we actually have a quiz for you that you can take to see which one of these you might fall into. And I'm going to give you some strategies to employ depending on which of these you might relate to. So the four phenotypes are hungry brain, so people who never feel full, or it takes a very long time. You eat meals and you just feel hungry no matter how much you eat. The next is the hungry gut, and these are people who eat a normal sized meal, but a few hours later it feels like you're hungry again. So this is people for whom food goes through the gut really quickly, and you only feel full for a short time, and you need to eat again. You need to snack. Food is sort of constantly around. There's also the emotional eater, or somebody who's a hyper responder to stress, where you get stronger signals, stronger craving signals during times of stress that are almost impossible to overcome. And then there's this slow metabolizer. So these are people who are doing everything right, which, whatever that means, people who are eating well, exercising, and but somehow the body is just not responding, and you're still holding on to more weight than you'd like to, than might be healthy for you. So I'll go through each one of these, and perhaps we can have Hari, could you put the quiz in the chat? So if people want to go through the quiz and figure out which one they are, or you can just um, think about which one of these fits you best. And if we don't have it in the chat now, we'll put it in. Oh, it looks like it is in the chat. So if you want to take the quiz and see which one you might be, you can do that. So the first is the hungry brain. So the problem here is that your brain's full signals aren't working. So you eat much larger portions than most people, and you feel hungry even after eating what seems like it would be enough for your body type. And people with hungry brain think about food frequently. You rarely feel really satisfied, and cravings feel really overwhelming. They can feel really strong. So people with this kind of phenotype, if you feel like this is you, some really good strategies are prioritizing protein. So protein is one of the most satiating foods, and it sends full signals to your body better than most other macronutrients. And having a protein-rich breakfast can really set you up for the day to tone down some of those signals that are telling you you're constantly hungry. Then eating slower and more mindfully, making sure that your brain has time to catch up with how much food you've had, and just slowing down your eating can be really helpful. And then also planning your meals every 3 to 4 hours and having reasonable portions during those time periods. The other interesting thing about these phenotypes is that Dr. Acosta found that different medications work best for different phenotypes. So we will talk about the GLP-1 agonists because everybody's talking about them now, but they are particularly helpful for people who are dealing with hungry brain because they can tone down some of those hunger signals and make that less overwhelming. But there's also other older weight loss medications that seem to be a good fit for people who are dealing with this. So the next one is the hungry gut. So this is people for whom the stomach empties too quickly. You're genuinely really hungry 1 or 2 hours after eating. So you've had a meal that's a decent meal, you felt full at the end, but then 1 or 2 hours after you eat all that, you're hungry again. And you're just not satisfied for long enough, and you're physically uncomfortable. It's not just a craving. You feel lightheaded. A few hours after you eat, you're just not feeling right. So if you relate to this, or if this is where what your quiz spits out, then combining all your macronutrients in a meal can be helpful, especially protein, fat, and fiber. Again, it's frequent, smaller meals are really helpful. And avoiding simple carbohydrates works really well for this phenotype. So really trying to reduce sugar and flour because those are things that just sort of go through you very quickly. And the GLP-1s also work really great for people with hungry gut, having some fiber supplements with meals. And this is a type of fiber that can also slow absorption that helps some people. So then there's the emotional eater, and I think most of us, or a lot of us, can relate to this to some degree. I know I can, where during times of high stress, your ability to make good choices is is less than it would be otherwise. I tell my patients a lot of the time that we wake up with a certain amount of willpower every day, and your day steals that from you as you go throughout the day, and you have to use your willpower to show up at work and do a good job and be nice to people. And at the end of the day, it's your willpower bank is super low, and that's when it's important we set ourselves up to make good choices. So, emotional eaters are people who use food to cope with emotions or just have very strong cravings when during times of stress or when you feel upset. And uh, this is people who eat even when you're not really hungry, but just stressed, and food really feels like comfort in these situations. So, this is sometimes a little bit more tricky, but I think it's important to kind of recognize that in ourselves if that is something we're dealing with, and be a little more intentional about what we're going to do when stress comes up because we know it's going to, that's life. And finding other ways and knowing, not waiting until the moment that it happens and you're turning to food, but finding other ways to address that stress, and that's a highly personal journey. Um, and there are other medications that can help with that. Especially the naltrexone, bupropion, that's Contrave. It's an older medication. They're not as effective as the GLP-1s, but some people who are really struggling with emotional eating can benefit from some of these older medications as well. And then the last one is a slow metabolizer. So these are folks with a slow basal metabolic rate. So that's the amount of calories you burn just to stay alive. And for some people, it is just slower, and your metabolism runs slower. So I meet a lot of women in particular who tell me that they eat very little, and yet they don't lose weight. And especially after menopause, we can be thrown into this slow metabolizer phenotype. So this is someone who gains weight easily, loses very slowly, eats reasonable portions but still struggles, and just feels like their metabolism is stuck, has tried a number of things and it's just not working. So one great thing to improve your metabolism is strength training and building muscle. Muscle really, having a good amount of healthy muscle can speed up the metabolism and can improve insulin sensitivity, which is often an issue for slow metabolizers. So both strength training and high intensity interval training can break the slow metabolizer out of that cycle. And we don't want people who are slow metabolizers to drastically cut calories, which is often what the impulse is to do. I've had women tell me they eat 600 calories a day, drastic cuts, and that is not helpful for the slow metabolizer. That will just give your body signals that you are starving and you need to hold on to all that food and any sort of fat tissue that you have. And we have more medical strategies to address. I think the slow metabolizers, checking in-depth hormone panels, including thyroid, adrenal health, insulin resistance, hormone health. I think it can be really helpful in optimizing the body in that way. And sometimes the older drugs like phentermine can be really helpful for the slow metabolizer. Moving on, and we'll do some questions at the end, but we'll talk a little bit about the GLP-1 agonists because I know that they are on a lot of people's minds, and there's been a lot of information, a lot of news, and we've heard it all, the good, bad, and the ugly. Um, uh, these medications came out 10 plus years ago, and they're peptides, which are short chains of amino acids that mimic something that is already happening in the body. These particular peptides that are called GLP-1s increase the amount of the hormone GLP-1 that is produced by the body. So you might have heard of the drugs that are available. Semaglutide is the generic name for Ozempic and Wegovy. That was the first medication that was ever made. Actually, that's not true. That was the first GLP-1 that actually resulted in significant weight loss. Liraglutide or Saxenda was made before that, but it actually does not, it's good for diabetes, but it does not result in significant weight loss. And the semaglutide, which is Ozempic and Wegovy, tends to have more side effects. So more nausea, sometimes diarrhea, constipation. And so the second generation of GLP-1s was created, which is Mounjaro and Zepbound. And these work on two receptors, GLP-1 plus something called GIP. And we're seeing less side effects with those. And they are somewhat more effective for weight loss. So the Mounjaro, Zepbound, both of those are tirzepatide, and this works on two receptors. And it is a little more effective for weight loss. There's a third one coming out soon. It's in phase 3 clinical trials. That's called retatrutide. That is a triple receptor agonist. And the trials so far seem to suggest that it's going to be even more effective with less side effects. That should be coming within the next few years, and should be exciting to see what we have there. So, what do these drugs do? There are still facets of these drugs that we don't understand, which is often the case. These actually were developed from Gila monster venom, a strange place for these to be discovered, but we found that they act on the brain's hunger centers, and they certainly help control appetite. They also slow gastric emptying. So for those hungry gut folks who have their stomach and their gastric contents empty too quickly, and you feel hungry a few hours after a meal, that is well addressed. They improve insulin response. So for the slow metabolizers, they do improve metabolic health and the gut hormone response to food. And they also reduce something called glucagon, um, which is the blood sugar, which is sugar that your liver produces that can also contribute to gaining weight. I'll go through the potential benefits and then potential risks and who this might be right for and who should probably stay away. So the studies that we have on the GLP-1s show that people lose somewhere around 15 to 20% of their body weight over 12 to 18 months. So if you're someone who weighs 200 pounds, you lost 20% of your body weight, that's 40 pounds. That's over a year to a year and a half, which is great. It's more than any drug we've ever had can do. We use these strategically in my practice, and most of our patients lose about 25 to 30 pounds in 12 weeks. Rather than this 15 to 20% over 12 to 18 months, we can usually get people to safely lose at least 15% in the first 12 weeks, which is a better timeline because it can get really frustrating if you're waiting a year and a half. Um, the GLP-1s have been shown to reduce your visceral fat. So the fat that's around your organs, that's deep in your body, is more dangerous than the fat that you carry under your skin. And the GLP-1s are good at reducing that fat. Another benefit is that we've seen numerous studies with improved cardiovascular outcomes. So a 20% reduction of major cardiac events, that's heart attacks, heart failure. There seems to just be some protective effects for the heart. They are somewhat anti-inflammatory. So I've had a lot of my patients tell me I'm less achy, I feel less tired, I'm less inflamed, and they can be protective for the liver and kidneys. So lots of pros there. And the potential risks. So the ones that I think most people hear about most are the nausea, vomiting, diarrhea, constipation. Those are the most common side effects. The way we use them in my practice, we really use the lowest effective dose, and we have not seen significant side effects like this. Some people do get nausea, but we basically switch the agent that we're using or move away from it or use different strategies to mitigate it. But people who increase their dose too quickly, people who are using the Ozempic or semaglutide are much more likely to get the nausea, vomiting, diarrhea, constipation. There's been cases of small bowel obstructions. Um, the trial showed some potential increased risk of pancreatitis. This seems to be rare, but if you're someone who's had pancreatitis and it can trigger that again. And if you're somebody who has gallstones, gallbladder stones, there is an increased risk of those stones causing gallbladder attacks. So people who have had problems with pancreatitis and gallstones probably shouldn't take these drugs. Um, where we have to be extra careful and really, really watch for those side effects. And then there's potential side effects that are under investigation, potential risks. There were some animal studies that showed an increased risk of these thyroid C cell tumors. So this was not identified in adults. When we looked at adults for 10 years plus, there was no increased risk of thyroid cancer or any sort of cancer. But in animals, there was this signal. So this is still somewhat unclear. I think that we have a lot of good studies that don't show an increased risk of cancer, and it's something that I'm not particularly um, concerned about, and it just doesn't seem to be borne out in the human studies. People who have diabetic eye disease, that is a group of people that we have to be extra careful with or probably avoid using these drugs. If anybody has diabetic eye disease, we want clearance from your ophthalmologist before you do this. And then dehydration is mostly just if your appetite is suppressed and you're not drinking. You have to be careful and drink your fluids. And then there are risks with inappropriate use. So in our practice, most my goal for my patients is to gain or maintain muscle and lose body fat. So I don't care about the overall weight number all that much. I just we want to improve body composition. So if you take high doses of GLP-1s and change nothing else, you will lose muscle, and that is probably not a good thing for your health long term. Loose skin, nutrient deficiencies, those are all things that can happen. So who benefits and who may not be the ideal candidate? So the people who have hungry brain, hungry gut, and stress responders, the emotional eaters, respond really well to the GLP-1s. We found that a lot of slow metabolizers also respond well, but sometimes we have to address other factors. And sometimes we need combination therapy, and we have to be a little bit more uh, we have to come up with a more personalized plan for people who are slow metabolizers. Um, so if you've tried multiple lifestyle changes without sustained success, if you're pre-diabetic or type 2 diabetic, if you're really struggling with persistent hunger or portion control, then these drugs may be a good idea. And they can definitely help with those things. The people who should not take this, people who have a history of gastroparesis, which is a rare freezing condition of your stomach, anyone with an eating disorder, anyone who's pregnant or planning pregnancy, should probably not take this. So just to wrap up about the GLP-1s, um, they are not a quick fix. They're not a magic wand. I've worked with a lot of patients. I've worked with a lot of patients who took the GLP-1s and didn't change much else in their lives and really was not happy, were not happy with the results, even though either the weight was not coming off or it came off, but there was a lot of loose skin and muscle loss. So I think that they're really helpful when they're integrated into a strategy for weight loss. Um, there's a lot of debate about short-term versus long-term use. There are uh, there's certainly options to use these medications long term, but we've worked with a lot of people who just want to get the weight off and then use a more natural approach to keep it off. And I think that that is possible for most people. Um, and the brand names of these medications are still very, very expensive. And for a lot of people, insurance is not covering this. There are safe compounded versions as of right now, but that is a changing landscape. And again, I could speak a whole hour about this. So that is something to discuss with your doctor if you're thinking about this. Um, and if you're thinking about entering a weight loss program, especially a medical weight loss program, I just want to go through some criteria that you should be thinking of on how to assess if this program actually has the potential to do what you want it to do. So you want a doctor involved in your care. If you're going to do medical weight loss, you want to make sure that somebody who's actually knowledgeable about metabolic health and weight is involved in your care and monitoring you. You want to make sure that your program's actually personalized. These one size fits all solutions don't actually work for most people because we are individuals and we went through a ton of reasons why different people are holding on to weight today, and there's many more. And somebody needs to assess you as an individual and help you figure out where to go with this. You want a realistic approach. We do 1 to 3 pounds a week is usually good. If you're losing more of that, you're losing muscle, and that's usually not sustainable. And you want to focus on lifestyle, not quick fixes, and have a lot of support. You know, it can be really lonely and really difficult to be stuck with this problem in your own head. And having somebody who you trust, who guides you through the process, I think is really important. So you don't want to invest in programs that offer a miracle rapid weight loss, expensive supplements as the main treatment, no medical oversight. If anybody was guaranteeing specific results for everybody, you want a program that feels like a partnership that explains why their approach works for you, um, and gives you personalized care that's specific to you. So just before we wrap up and we take some questions, I want to tell you a little bit more about our weight loss program at the Gaia practice. We combine personalized health coaching along with optional medication that would work for your body and what you need to actually get to a healthy weight and maintain it. Um, Not everybody uses medications, but most people do make use of them just to help you along. Most of the time, by the time you come see me, you've tried a number of things and you feel stuck. And we find that this strategy really works when we do this weekly health coaching combined with potential medications. We track your weight with in-body scans that give us your body composition, your percent muscle mass, your percent body fat, to actually understand what's happening on the inside. Because again, I want you to lose fat and gain or maintain muscle. I also have an online course that's quite comprehensive that gives you a lot of strategies, meal plans, shopping list, restaurant guides, and more. So we have a special offer for anybody who's on this webinar. The monthly value of everything that we include in our program is about $2,500. Our usual monthly membership is $525, but for anyone who's here today or who's watching the replay, we have a special offer of doing your first month for 50% off. And so that's you get most of your meds included, and um, you can do your first month for just $262, which includes all your visits and everything else that's there. Also, for anybody who's here, we're offering with the purchase of our weight loss program, we're offering a comprehensive lab evaluation where we'll draw labs in our office and look at anything that might be standing in the way of your weight loss. Any of those things that we talked about in the beginning of our presentation. Your hormone levels, your levels of inflammation, thyroid, fasting insulin, insulin resistance, different vitamins, adrenal health, and then you'll get a session with myself or my nurse practitioner to go over all your results. So, Hari put that link in the chat if anyone's interested. And I'll take any general questions now. And if anybody has any questions that they'd like to ask in private, I have my directors of our weight loss program, Michael and Patrick. And if you just put the word breakout in the chat, we'll put you into a private breakout room with one of them. And if you have any questions that you don't want to ask to the group, um, you can talk to Michael or Patrick in private. But otherwise, I'll take any questions anybody has.
Oh,
I see a question here for the semaglutide. Are those shots and how often? Yeah, that's a really good question. I'm sorry I didn't answer that more in
um,
depth. So, yes, all the GLP-1 medications are injectable. They are they have not figured out how to create a version that's not basically destroyed in your stomach. So they are once a week injections. They are done with a very tiny needle. It's like an insulin or allergy needle. So it's like a hairpin. You barely feel it. And usually it goes right under the skin. Um, Most of the time we do it in the stomach, but it can be done in the thigh or the arm as well. And you do the small injection once a week. And you can do either come to our office every week and we'll do your health counseling visit and give you your shot, or some people choose to do telemedicine check-ins with us, phone calls once a week, and you do your shots yourself at home, which we can coach you how to do, teach you how to do. Some people just like to FaceTime us and we'll do your shot with you so you know you're doing it right. Um, but yes, they are all injectable, um, but they are very manageable injections. They're not painful. And if we've run a little bit past our time. If anyone has questions, they want to shoot over to our email, that's perfectly fine too. Or um, I'll hang around for another minute just in case there's any other questions. But thank you everyone so much for coming and hope you have a great day.